So imaging. A lot of times patients come into my office and and I have them get x-rays. All new patients, they get dynamic x-rays, flexion extension. If they already have flexion extension, then I don't. But typically, 9 out of 10 patients will not have flexion extension x-rays. So they'll say, I've already had x-rays. You know, the ER did it, the primary care doctor, the chiropractor, they did x-rays. But they have to, for me, they have to have flexion extension. So that's really important. And so I train my staff to explain to the patient so they understand why they're getting these special x-rays. So what I'm looking for is instability, spondylolisthesis. I'm looking for a slip. If you just take an x-ray, a lateral x-ray in a patient's spine, a lot of times it looks aligned normally. There's no slip, there's no anterolisthesis, there's no retrolisthesis. But as soon as you have them flex forward and shoot an x-ray, or you have them extend back and shoot an x-ray, now you see a slip sometimes, right? So that's what I'm trying to catch with the dynamic x-rays. The next thing I do, if it's indicated, you know, if they've been having symptoms for greater than 4 weeks or they have some sort of neurologic finding or deficit, is an MRI. So that's the gold standard when you're assessing spine pathology, is an MRI. So when do we get these other scans like CTs or CT myograms? Well, if they have a contraindication to an MRI, for example, they have a defibrillator or a pacemaker or a spinal cord stimulator or a pain pump or things like that, big metallic implants, those are contraindications at this moment in time for an MRI. So in those instances, what I get is a CT myelogram. So not just a CT. CTs are good to assess bone, as we all know, but they're really not that good at assessing nerves and neural impingement and herniated discs. If it's a really good scanner, you can get a broad sense of if someone has severe stenosis. But for what I'm trying to decipher between, you really need a myelogram added on to that CT. So if they have a contraindication to the MRI, I get a CT myelogram. The other time I would open is if they've had prior surgery with instrumentation, with screws or rods or cages. Because in that case, I'm assessing for fusion with the CT, but they're having some new symptom or something's going on. So I want to add on the myelographic component to see if they have neural impingement as well.